Hello, my name is Mackenzie Dawson, and I would like to introduce you to my sister, Chelsey Irving. She has 2 degrees at the age of 26. One of them is a biochemistry degree, and the other one is a nursing degree. She currently works as a research nurse at St. Jude Midwest Affiliate at St. Francis, OSF St. Francis Hospital in Peoria, Illinois. First, I'm going to talk about her first degree, which is a biochemistry degree. Why did you choose biochemistry?
Well, ever since I was a little kid, I've always loved sciences. Always been drawn to them. As I was getting older, I couldn't really make the decision between biology and chemistry. Therefore, biochemistry was a great mix, and because it was the biological study of chemical things, and kind of the interactions between them.
That's a really great answer. I'm really glad that you could share that with me. What made you change your mind to nursing if you were so passionate about science?
Absolutely. So throughout my first degree, I worked in a research lab, a couple different labs actually, doing research, and I loved it. Still love the subject, but as I kind of got older and grew into myself, I realized that I wanted some more human interaction. Being in a lab, all I did was work by myself independently. And after a while, that wasn't what I wanted. And I've always kind of had this passion for nursing. And so halfway through my junior year, I decided that I wanted to do nursing. And so the fastest way to do that was to finish my biochem degree and then do an accelerated nursing program. So I was able to get my bachelor's in nursing in 15 months.
Well, it seems like this position has really fit you by your description. Now, where did you do your schooling at?
Yeah, so I attended Bradley University in Peoria, Illinois. It's a small private school. It was close to home, which was nice, and they were, at the time when I was in biochemistry, they allowed sophomores to start research. So I was able to start my research career earlier than many other universities.
Well, the school really benefited you.
Absolutely.
And now we're going to move on to her current career, or to her early nursing career first. How long have you been a nurse for?
So I've been a nurse for a little over 2 years. I started my career in the emergency department. Fast-paced, ever-changing, crazy place to be. I absolutely loved it for a while.
Yeah.
It was a great...
Get tiring.
Yeah, absolutely. It was a great place to start. I learned more knowledge than I would have learned anywhere else about nursing, as well as myself, being put in situations to have to think critically. And so that was awesome. But after a while, I learned it just wasn't the place for me. I needed something different.
And where did you go after that?
Yeah, so after that, I kind of used a stepping stone. I wasn't really sure what I wanted to do. So I went to pre-op and post-op and surgery. So that's where I kind of helped get people ready for surgery. So getting them checked in, IV started, things like that. And then after patients had surgery and were going home for the day, we would help to recover them, give them all their home instructions, make sure that they understood what they were doing.
So you still got human interaction, but it was a little slower pace in the emergency department.
Yep.
Gave you a little break.
Yes.
So what made you switch overall? Just
to the career I'm in now?
Yes.
Absolutely. So where I'm at now is where I've always wanted to be. So when I became a nurse, I still have the passion for research, and I truly believe that the foundation of medicine is based on research. Mm-hmm. And so my goal has always been, when I became a nurse, to end my career hopefully interacting and changing and combining my nursing and research. And so this position became open as a research nurse for St. Jude, and it came a little earlier in my career than I expected. It was one of those that I thought that have a couple more years with more patient interaction, and I ended up here. So it was kind of a by chance thing. But it's the perfect fit, and it's literally my dream job.
So you lucked out.
Yeah.
What were some of the experience you had in your early nursing career?
Well, there's probably more than I can go into right now. I had a lot of different interactions with patients and families in the ER, especially. I always ask if you have those crazy stories. Absolutely, I have them.
Probably have a list full of them.
I do. They're great, which I won't go into today.
No, that's okay.
But not only did I have the experiences to learn about the patients and critically thinking situations, but I learned a lot about myself in those early days. I was able to learn a lot about how to think on my feet when I didn't have the staff, when I didn't have the resources, and how to best care for the patient in the safest manner.
A good building.
Absolutely, and I learned a lot too in surgery. So, even though you're a nurse doesn't mean you know everything about everything.
Yeah.
Okay, you usually have a specialty. So it was really cool, to be able to see the nursing side, but also see the surgery side. They're just different. I was able to expand my knowledge base. And in the surgery, pre-post, I was able to actually interact with my patients a lot more. I was able to have conversations, sit down and take the time, and I lacked that in the ER, and that's one of the things I didn't like about the ER, because I was so busy and overwhelmed that I never had time to sit down and interact.
Connection, really.
Exactly.
Yeah, which is nice.
Yeah.
And now we're going to talk about her current job, her dream job. Could you tell us a bit about what you're doing at St. Jude?
Absolutely. So St. Jude is an organization out of Tennessee. They're a big children's research hospital for childhood cancer. And so we're one of their affiliates, meaning we work hand in hand with them. But we also do other research studies. So I'm dealing strictly with patients or children that are on a research protocol. So meaning that their care is directed by a research study. And so I'm doing a lot of the behind the scenes, a lot of the regulatory stuff, making sure that the patient, meets the criteria to enroll in the study.
For the study, yes.
And that, there's certain testing that needs to be done along the way, certain samples, for studies that they're testing. We're making sure of that. We're looking at any adverse events they have if they're on a drug, a study drug. We're the ones that are reporting all those, as well as we're also on the regulatory side. So dealing with human subject research, you have to deal with the regulatory side.
So you're not actually doing the research, you're just doing the behind the scenes.
A lot of it, yes.
Okay. So do you see this as a lifetime career?
Absolutely.
All right. So what are some of your emotions so far dealing with it?
Well, it can be difficult at times. It's one of those that it can be happy. When you see a kid, we have them ring a bell and they get a cancer-free party. But then it's also very sad because you see the patients that aren't responding to the treatment. So it's a wide gamut of emotions.
Understandable. Well, thank you for listening, and I hope you have enjoyed learning a little bit about Chelsey Irving.